Okay, hello everybody, and welcome. You are now with the WFNS Spine Committee monthly newsletter. My name is Nikolai Pev. I'm a consultant neurosurgeon from Belfast, and I will have the pleasure today to talk to Professor Mehmet Zileli, who is one of the most prominent and senior Spine Committee members, and also with Professor Erika Bison, who is one of the new WFNS Spine Committee members. Erika is a very active neurosurgeon with spinal interest, very active. So far, she published over 140 publications in peer-reviewed journals. Erika, would you please present yourself? Tell me what is your most exciting and new project that you're working now?
Excellent. Thank you, Nikolai. I'm Dr. Erika Bison from the University of Utah School of Medicine, and it's an honor and a privilege to be with you today for this interview of our past chair of the WFNS Spine Committee. I'm a professor of neurosurgery and adjunct professor of orthopedics at the University of Utah in Salt Lake City. I'm also the director of our Complex Spine Fellowship and president of our University of Utah Medical Board. In addition to the work I do at the university, I do spend quite a bit of time on multi-center collaborative trials looking at outcomes in spine surgery and doing comparative effectiveness studies as part of a large collaboration. Again, it's my pleasure to be part of this committee and to partake in this upcoming interview. Thank you.
That sounds like an interesting project, and I wish you luck with that. I guess now we can continue with Professor Mehmet Zileli. I hear Erika has prepared for you a few interesting questions, Mehmet. Are you ready to continue?
Yes.
Okay, Erika, please.
Excellent. Well, first I want to say it's an absolute honor and privilege to be doing this interview with Dr. Zileli, who is not only a global leader in spinal neurosurgery, but also has really dedicated his career to global spine education on many committees and organizations throughout his career, but most recently with the WFNS and the Spine Education Committee. So again, a complete honor to be doing this interview. Let me start with asking you, how would you summarize the work of the WFNS Spine Committee over the last few years during your leadership?
Thank you, Erika. Thank you, Nikolai. It's my pleasure to be with you in this interview. My term has just ended in 2021. It was from 2017 till now, about 4 years. And since 2017, the Spine Committee achieved many of its goals. First, we prepared a website, which is now very active and getting too many visitors. It includes meeting announcements, newsletters, recommendations, webinar recordings, etc. And we started publishing a newsletter once a year. Oscar Lu Alves was the editor of that newsletter. We started doing virtual symposia and webinars since 2018. And the numbers increased during COVID break times in 2020 and 21. Really, we could not get opportunity to have live meetings and in that period, as you know. And more valuable activity we performed during the last 4 years can be considered preparing the guidelines on some common spinal disorders. And with great contributions of many active members, we prepared and published many WFS Spine Committee recommendations. Among those, I can count cervical spondylotic myelopathy and OPLL, lumbar spinal stenosis, cervical trauma and spinal cord injury, thoracolumbar trauma, and osteoporotic vertebral fractures. We published many papers in the name of WFNS Spine Committee in different open access journals. We always try to be open access to have reached those recommendations to all world neurosurgeons. We also published a book called Cervical Spondylitic Myelopathy and OPLL by team publishers in 2021. These are what we could achieve with the contributions of very valuable members.
Thank you. You clearly, you leading the committee and the committee itself has accomplished a great deal in the just short period of time where you were in charge. What would you say is your vision for the future of the WFNS Spine Committee?
I'm sure it will be more bright than our period, and I wish the Spine Committee to proceed to prepare recommendations on other spinal disorders as well. We had a plan to prepare a basic and advanced spine curriculum we could not achieve during our times, since we did not get a permission to start that program. I wish the new committee can succeed to start that program, especially in low and middle income countries. I believe WFNS Spine Committee must have a pioneering role in developing a spine training program for neurosurgeons. We had also plans to prepare consensus meetings on basal invagination and Chiari malformation and spine tumors. I think new leadership and new committee members will proceed on that.
You clearly are very passionate about spine education. I think it's fascinating and such a remark to service with the idea of a spine education curriculum in low and middle income countries, so we can serve globally our individuals and neurosurgeons, both in training and young neurosurgeons. What would you say is your message to the prior members that already served their time in the committee and to the new members?
Yeah, thank you. I also mentioned some, but I appreciate the willingness of the previous committee members to devote significant time and their expertise on preparation of the above mentioned activities. It would be impossible to finish them without their great collaboration, and especially consensus meetings and manuscript preparations took a lot of time of this great group. I thank all of them. If the new members can show similar efforts, I'm sure the WFNS Spine Committee will remain to be the most productive committee of the WFNS. I'm sure for that.
We always say we stand on the shoulders of giants, or we stand on the shoulders of those who came before us. And I couldn't agree with you more. Just being a brand new member of the committee, seeing all the work that's already been developed by the prior members, it's absolutely invaluable. And I am fortunate to have seen all the work that has been done before and continue to engage those individuals in a very meaningful way in order to move these programs forward. So couldn't agree with you more. I had a question about how COVID has impacted the global education of spine. And I know you mentioned a little bit about virtual meetings versus in-person meetings, but how do you feel that COVID restrictions affected the WFNS Spine Committee activities in particular?
Yeah, it's a fact that actually we could not make any live meeting. Even our biannual meetings, who was promised to be done in Milan in 2020, was postponed, and then we could do it as an online meeting in 2021. We learned how to be proficient in online meeting organizations. This is what we did at the same times. Sometimes we had 2 to 3 meetings in a month. Besides, we organized 12 virtual symposia, of which some of them were taking 5 to 7 hours a day. Some examples are virtual symposia of craniovertebral junction surgery, virtual symposia on adult degenerative deformity, or minimally invasive spine surgery, or update on spine tumors. And this last one was with collaboration of the Korean Spine Oncology Research Society. There is a society with this name, actually, and included 6 panels with about 20 speakers. It was like a congress. Yeah, we learned a lot from each other, and having engaged with online meetings, it was very different times, actually. Thank you.
You know, I think that obviously the world has changed in the last 2 years, and we have all learned to work virtually and meet virtually on many levels. I think that there is a sense that we've learned how to engage better virtually, but there is also a sense of a little bit of a loss of the personal touch when we are not able to gather in person. There's pluses and minuses. I'm curious what you think in the future. Will it be some combination of the two in order to allow us to meet as a group from distant places on the globe versus that feeling of getting together?
Yeah, this is the fact. Yes, there are some big advantages of online virtual meetings. Like you can reach everywhere in the world without any significant cost. They no need to travel. The people can sit down at home and then watch and ask questions to the very valuable presenters. But it is still lacking a sense of humor, and the human being has psychology to react with seeing, looking, and even smelling the environment. These are senses that we need to learn, and some aspects are getting lost with virtual meetings. And another thing is the medical information is very dynamic and has a rapid change of character. And updating the knowledge is possible by making continuous critics and re-evaluation of our results. Young generations are aware of that. Probably we somewhat senior persons are not that much. It may be probably my reaction to that. But the young generations are very keen on that.
I couldn't agree with you more on all of those comments. I think, you know, we are living in a new world and there are advantages to everything. We just have to also understand we don't want to lose the humanity and the camaraderie that we experience when we share information, education, and technology together. What would you say is your message to young neurosurgeons, and particularly young spinal neurosurgeons that want to follow in your footsteps, being a global leader and being so involved in global spine education?
They must be patient, and they must be open to learning. Actually, even after being very senior, we are still learning. There is no phase of life that learning can leave somewhere. I mean, without this process, we can't do anything. probably. So we were in the past, we were calling postgraduate education, but this is lifelong education, I think, and I'm sure they will invent more, and they will achieve more in the young generations, I mean.
Thank you. I think, you know, as the technological advancements continue to progress at an exponential rate, I couldn't agree with that statement more. We as neurosurgeons have the phenomenal opportunity and privilege to be involved in a growing and ever-changing field. I personally, I think it's probably for many of us either listening to this, feel the opportunity with lifelong learning, and it's one of the great benefits of our specialty is not only to take care of individuals and really be advocates for our patients, but also be on the leading edge of discovery on a continuous basis throughout our careers. You have been such a phenomenal example for all of not only the education, the WFNS Education Committee, and all you have achieved over the what seems like a short time, must seem like for you even a short time. The years go by very quickly, and I can't thank you enough for engaging in this interview.
Thanks a lot.
Thank you so much.
It was a great pleasure for me. Thank you both of you.
I think it was a great discussion, and I'm thinking as continuation of your conversation, maybe soon we have to meet in metaverse. But I still, I think I'm missing now the old meetings where we can actually have some personal connection.
Yes.
I'm hoping that this will come.
In-person meetings are great. Yes. Yeah.
Yes. We can all look forward to meeting in person in the near future, hopefully.
Let's hope that, and I think this is a good closure of the meeting today. Mehmet, do you want to say something just to close?
This is fine. It's great to see all of you so motivated, and then wish to achieve big goals. I'm sure you will do it.
Thank you.
Thank
Hopefully
you.
we'll meet soon.
Thank you, Erika. Thank you, Nikolai.
Yes.
Thank you all.
Thank you.
Okay.